Do you find that there are times where having a plastic surgery helps a person's mental health?
Definitely. I think that's true most of the time. And the key, I think, is the difference between body dissatisfaction and body shame. If you are unhappy about your appearance, but you have a sense of self-worth, you're unhappy because some aging change has happened, or you don't have the figure you did before you had children, or you have the family nose and you don't like it, and yet you have a sense of preciousness and value, then plastic surgery is very effective. People have the surgery, the surgery goes well, they're happy, they go away content. It's when people have body shame and they feel that their self-worth is determined by how they look. That's when plastic surgery is never works, because the real goal of the patient is not to get rid of the deformity, it's to feel um, valuable. And interestingly, the key piece to me in the mental health literature was a series of papers by Bernice Andrews, a psychologist in the UK, about 20 years ago, where she had identified various types of shame: behavioral shame, the way I act, characterological shame, the kind of person I am, and body shame. And she said that body shame was the most common kind of shame that resulted from childhood trauma. And I thought, that's what ties everything together. So when patients have what the surgeon considers to be a successful surgery, and they come back and they start saying things that seem out of context. Patients say to me, you destroyed my life. What you've done to me borders on the criminal. You've taken away my family, my friends, and my joy of living. I trusted you and you betrayed me. This is weird stuff. It's not like saying there's a little irregularity or something's not symmetrical, can you fix it? It's a personal attack against me. And that's what used to disconcert me, because I think
Sure.
that this doesn't go along with what we're even talking about. But if my idea is correct, and these patients have been shamed or traumatized in childhood, as my data shows most people have been when they react this way, when they're addicted to plastic surgery. If they go through the surgery looking for self-respect, self-esteem, feeling I'm not defective and I won't be defective anymore. I'm defective because of the way my nose looks, for example, and I won't be defective after the surgery. And then they come out feeling the same way they did. They go right back to that childhood wound, only now the surgeon becomes the perpetrator.